what will really drive true, lasting community change is to have all of us actively working in their sphere of influence to not only change their institutions, but collectively to change the profile of the community at large.
Fully engaged leadership teams are critical to the success of this type of work. By bringing together leaders that represent all aspects and all facets of our community, we can build coalition, we can work collaboratively to make a difference.
The Healthy Communities Partnership of Southwest Indiana is a cross-sectoral collaboration in multiple counties across the region. We're working to create tobacco-free environments.
The University of Southern Indiana began its no smoking, no tobacco policy in July of 2011. And even at that early point in July of 2011, we included e-cigarettes as a violation of the spirit of the no smoking policy.
We are working to educate residents and landlord decision makers about why it's the right decision to take their apartment complexes smoke-free, not only for the health of the residents, but for their bottom line as well.
We're working to provide healthier eating and active living options, as well as providing clinical preventive services that are very necessary across, especially our rural areas.
With Heal at Home, we bring in equipment and we instruct the patients on how to self-monitor with that equipment between the actual nursing visits. It's really helpful, in particular for rural patients who live further away from a clinic or a hospital.
There are 2 major health systems working to create a baby-friendly environment.
Baby-friendly is such a great playbook to utilize to make sure that we are doing everything possible to provide our associates, our physicians, with the tools that they need to ensure that they are providing that best experience.
It allows us to use our resources more efficiently. In addition, since both hospitals in general look at evidence-based protocols and guidelines, why not do it together?
There are over 40 child care centers looking at the policies and environmental aspects of their work.
We've really sparked an interest with the kids. We have parents that have come in and said, oh my gosh, what have you done? Because now my child's coming home and they don't want the junk food. They're asking for a fresh orange or a fresh apple.
We're also working with over 56 schools to create a more active and healthy environment for the students.
Our PTO has been extremely supportive in the fact that they provide all the food for our classroom parties, fresh vegetables, fresh fruits, pretzel sticks, cheese cubes.
Take 10 has helped with classroom performance, not only with our behaviors, but also as they're learning their spelling words, they're learning to count, they're able to get up and move, and I think when learning is fun, it definitely helps the students, it sticks with them.
The SPARK program has had a very positive impact on weight loss and BMI for our students. In the physical education classes, we don't have as much downtime because we have students doing various things throughout the class period. The data suggests from the state that our math and English scores have actually gone up through the implementation of these programs.
We have over 100 work sites that are looking at their policies and looking at how they do business to see if they can create a healthier environment for their employees.
We chose to participate in the Corporate Champions Worksite Wellness Initiative because we found that this was just an ideal blend and a support of corporate wellness across our entire community.
As a city, we wanted to set an example for the rest of our community. But for more on the personal side, these are people that we see every day. We know everyone in our department, and you want those people to have a good quality of life, to be successful, and enjoy being part of the workforce.
And also, how can we develop a regional food system so we can eat the food that is grown right here in Southwest Indiana?
Anymore, the way the younger generation, they like to meet the person that's actually raising it to see where it's coming from. So they like to know what they're eating.
We had a young lady selling tomatoes, and we brought them in and put a big sign on Mercedes tomatoes and sold an awful lot of them. So as much produce as we can, we will buy locally and resell it.
We are trying to create opportunities that will provide access for people to be able to enjoy the roads, more sidewalks, have access to trails.
We want to promote the expansion of our trail network. We've got a wonderful greenway, and we'd like to expand upon that.
When you make streets more bikeable, they become more walkable too. And I think motorists feel more secure when they're driving down a road with a designated bike lane because they know where cyclists are going to be, so it's less stressful for everyone.
What we do, we decrease the lanes of the road from a 4-lane to a 3-lane and add more bike lanes to that.
In September 2013, the Healthy Communities Partnership of Southwest Indiana was recognized by the White House Champions of Change Public Health Program. Our team traveled to Washington, D.C. and shared about our efforts toward policy, systems, and environmental changes right here in our region.